All right, so welcome to our pre-briefing. Before we get started, let's just kind of go over the ground rules, okay? So you guys are obviously prepared for your simulation lab today, okay? You have your stethoscope, your name tag, your pen light, etc. We also want to treat this patient like a real patient, okay? So you just have to kind of get that into your mind, that this is a real patient, you're taking care of the hospital. Saying that, our confidentiality statement that y'all signed beforehand states that you will not share any information that is confidential about your patient care today, okay? So you do not share that outside of this classroom. Also, when we get into our debriefing, this is where we can speak openly about our experience, share our emotions, our reactions, without feeling judged, okay? And without judging each other, okay? We're a team here, okay? Any questions so far? All right, remember this is our safe learning environment. So pre-briefing, we're just going to take about 40 minutes to kind of get prepared for the day. Your scenario will last about 30 to 40 minutes, and then debriefing right after that will be another 40 minutes, okay? So let's review our learning objectives for today. This is going to kind of get you in the mind frame of taking care of this patient, all right? And this is something you'll need to focus in on throughout the whole simulation day today. So number one, provide individualized patient-centered nursing care using the nursing process as evidenced by conducting a focused respiratory assessment, therapeutic communication with your patient, and providing patient education and documentation. Okay, so you're taking care of this patient pretty well-rounded. And then number two, demonstrate critical thinking and decision-making as evidenced by recognizing abnormal findings. All right, so you're not taking care of a normal respiratory associated patient. You're taking care of a patient who's probably going to be in some distress, and we'll go over that, okay? Lastly, prioritize and implement appropriate nursing interventions when caring for the patient experiencing respiratory distress. So let's think about that. You guys had a pre-simulation assignment to prepare you for the day. So let's talk about that. Kind of discuss, the pathophysiology with someone who has respiratory distress relating to pneumonia. This guy, he has community-acquired pneumonia. Okay, so kind of think about that pathophysiology. What do y'all know about that? What did you research?
Is at risk for impaired gas exchange, or he does have impaired gas exchange.
Okay, excellent. Anybody else?
Means he has like fluid in his lungs.
Okay,
so
he could. Okay, how would you know that?
you can listen for crackles and
Crackles. Okay.
maybe coarse or fine,
Mm-hmm.
and check his O2 sat.
O2 sat. Very good. Excellent.
Probably gonna have difficulty breathing.
Okay. All right. Excellent.
He's at risk for falls because he's difficulty breathing.
Okay, so now we have a patient safety concern
Mhm.
too to focus on. Okay. Anything else? All right, so let's think about, what about your assessment? Think about your assessment. When you walk in, you take care of a patient with acute respiratory distress relating to pneumonia. What do you think some of your assessment findings are going to be that you might anticipate?
Shortness of breath.
Okay?
He'll be fatigued because of the
Yeah.
hypoxia.
Absolutely. Okay?
Possibly blue fingertips or lips.
Okay, and what is that called? Let's think about medical
Cyanosis.
terminology, cyanosis. And then what about the patient who is short of breath? What do we call that?
Dyspnea.
Dyspnea. Very good, dyspnea. Very good. Excellent. All right. And then think about your nursing responsibilities with pulmonary toileting. Okay, this is something that we as nurses can do maybe even without a doctor's order. So think about like coughing and deep breathing. What does that do? What does that promote?
Clearing the lungs.
Good, good. Especially if they have, crackles or a lot of thick sputum that's causing those coarse lung sounds, that might help clear that, right? And then the incentive spirometer. Why is that important for this patient?
Helps open up and strengthen the airways.
Good, good.
It prevents pneumonia, but he already has pneumonia, so it's going to help resolve that.
Good, good.
Mobilize secretions.
Good, mobilize secretions.
Get those
Excellent.
alveoli open.
Good, good. Because sometimes those can collapse, right? What do you call that one, those alveoli?
Atelectasis.
Atelectasis, very good. What do you think his alveoli are filled with?
Fluid.
Nasty.
Mucus.
Fluid, nasty, yeah, causing those crackles, low O2 saturation, right?
Could you also
absolutely.
use vibratory,
Yeah,
I don't know, on the back?
yeah, like
vibrations?
percussion,
What's the
to
word?
help mobilize it,
Percussion.
yeah. Yeah, there you go.
Thanks.
Kind of making a cup with your hand, or there's even
Yes.
instruments, electronic instruments that can do that for the patient. Yeah, absolutely. And then think about this guy. We're going to talk about his case a little bit more, but he's 75 years old. So let's think about, he's losing his independence. How are you going to interact with this patient? What do you think is important for him?
To have
Giving him choices.
Choices, very good. Because what does that do for him?
It gives him independence.
Independence, yeah, to make his own decisions. Yeah, absolutely. Okay. Do you think he's going to be a little nervous that he lives alone, losing his independence? And we already talked about safety, right? So we got to think about what we might see occurring in this situation. We got to think about when he leaves here, what's going to happen when he gets home. Okay, so just some things to think about. All right. So we have your roles already assigned to you. So what are you going to be doing, Creighton?
I am going to be the documentation nurse.
Documentation. Good, good. So you know your role, Courtney.
I am the assist.
Good. Charge nurse assist.
Charge nurse
Very
assist.
good. Nikki?
I'm assessment.
Assessment nurse, okay?
I'm the charge nurse.
Amanda is a charge nurse. Excellent. All right. So before we get started with that, our scenario, we're going to go in the room and just kind of orient you to the room. All right, just to make sure that you know how to work the touchscreen monitor, that you do have oxygen that works in the room, okay? And then if you need like the crash cart, I'll go ahead and show you the location of that as well, if you need it, okay? We just want to make sure that you guys know where all your supplies are, okay, so that you're fully prepared. And so let's just quickly talk about the patient's backstory here. I'm going to give you a little information, and then we'll go ahead and start our scenario. So in this simulated case, this is a 75-year-old male patient who's admitted to the hospital with community-acquired pneumonia. The patient struggles to maintain independence in daily care and refuses assistance despite dyspnea on exertion. Just before this scenario begins, the patient spills his urinal and his nasal cannula falls out of reach. The patient becomes dyspneic and turns on his nurse call light. It's currently 0800, beginning of your shift. And so now you know the starting point of this scenario, okay? So when you walk in, this is the state the patient's going to be in, okay? The monitor is going to display the most current vital signs, so you don't need to obtain those, all right? So think about your nursing fundamentals before you walk into that room. What are some important things that you need to do?
Hand hygiene.
Hand hygiene.
Introduce yourself.
Introduce yourself and your role.
Identify the patient.
Okay, using what
His
identifiers?
name and birth date.
Good.
Or his medical record.
Or his medical record. We've got those 2 or 3 options. Very good. Excellent. You guys have any questions about the day today?
We're good.
Think we're ready to go? Okay, so let's go ahead and we'll enter the patient's room. Start our scenario.